guys, welcome back to Healthcare India, and today we bring you the most interesting and yet insightful conversation with Dr. Raju Rhee, who has worked with different leading healthcare organizations like AstraZeneca and Pfizer. Also, he is presently heading the growth and business of MayaMD for the Asia Pacific region. And in this episode, we'll be talking about different things like future of healthcare, AI in supply chain, different applications entering the health tech space, and a lot more. So enjoy the episode and stay till the end because this is the conversation you can't afford to miss. You have been working with, MayaMD for around 3 to 4 months now. So I would like to know, how has been your journey been like till now? And, if you could briefly explain how MayaMD is, helping improving better physicians and patient outcomes, or maybe, contributing its bit towards better healthcare.
Yeah, thanks, Deepika. So I'm Dr. Raju. So my background has been in medicine. So I started my career as a physician. So I only practiced for a couple of years, but then I was more inclined towards the pharma industry and the corporate sector. So my initial stint has been with the corporate pharma industry. As a pharmaceutical physician, I also used to work very closely with the corporate marketing strategy, medical marketing teams. So was part of really some great companies like Pfizer, AstraZeneca, Menarini, where we were able to launch new products for the Indian market. I was also part of teams which were doing clinical trials, and that drug development process is very fascinating. So, for example, a drug which comes to the market right now takes at least 5 to 10 years, typically. But now we have seen that vaccine development is happening at a very fast pace because of COVID. So predominantly I went in the pharma industry, but having said that, I got an opportunity to work with clinical decision support system, CDSS system called UpToDate, which is one of the first CDSS systems which has been there from 1993. So it's almost 23 years, 25 years they have built the system. So it's used by more than 1.8 million doctors in 180 countries. So the fascinating part about this is already the AI part. There's a lot of AI which is getting a lot of attention right now because some of other sectors like fintech and banking, many sectors have adopted it at a very different level. So in healthcare, till before the COVID, what has happened is doctors were not comfortable using many of these systems in place because there's always an anxiety. Always people need more evidence because healthcare is a more evidence-based science. So unless you have an evidence, doctors are not willing to use. Even patients in India, they like to meet a doctor in person, so they don't want to talk to a machine. But with COVID, what has happened is a lot of things have changed. There has been a rapid digital transformation in India and in developing countries, which would have happened maybe in a span of 5 to 10 years. So with MyMD, what we are trying to do is our journey has been, we initially used to work with some of the education institutes in the US. So my other co-founder, Dr. Vipin, so he is a physician in the US. And then what he felt is there's a need to develop a CDSS system which can do virtual triaging. So our initial work has been with Yale University School of Medicine, some of the pioneering medical institutes where we were trying to develop algorithms wherein we can train doctors in clinical algorithms. So that's how we started. But then we realized rather than the educational market, this product needs, it can have a lot of value if we actually go to the patient solution market. The reason being, I'll give you a difference between how the US healthcare and the Indian healthcare works. So in the US, everything is completely covered by an insurance. So, so you have either a corporate insurance or you also pay for insurance. But in India, the current insurance coverage is maybe less than 10%. So we have a long way to go to to the sector that we are currently heading to. So typically in India, you can meet any doctor, say between which city you are based at, you can meet someone, say ranging from 300 rupees to 1,500 rupees. So it's not that costly for some big kind of people. But in the US, if you land up in an emergency room, you end up paying $10,000. So that's a huge amount of money. So wherein our initial endeavor was to make sure that we do a triaging. So triaging means segregating patients based on high risk conditions. So we can say that, oh, this condition requires immediate visit to a telemedicine or emergency room, etc. So that ways, the patient is saving money, insurance company is saving money, even hospital doesn't have to do that. So in India, where we are currently working is mostly in rural areas. So we have an installation in Odisha, where it's in a village called Ganjam, and there, the nearest doctor may be 50 to 100 kilometers away. So through our system, we are doing the initial triaging, and in India, patients may not be that literate enough, or there may be a class of people they may not be comfortable, using a symptom analysis tool. So there, we are trying to create village level paramedical staff who can put in the symptoms, and in less than 2 minutes, we get initial triage, initial things, and then that can be sent to the doctor. So doctor decides the final thing. So our AI, so a lot of times the concern for the doctor is, are you going to replace humans? So we are not trying to replace humans. We are trying to make your journey easy, because in India, a typical doctor would see 50 to 100 patients in a day. Like if you go to a busy GB, like you would have also seen, right? So a lot of patients are always sitting, in the just outside the chamber, waiting anxiously. When can I see the doctor? And a lot of times we also say, the bigger the doctor is, the crowded his rooms are. So there's a lot of people waiting outside. So you feel that, oh, I should go to the same doctor. But what we are trying to do is, we want to minimize this entire experience, customer experience, wherein you only need to visit a doctor when needed. So yesterday I was speaking to a friend of mine. He was actually doing a staycation in Himachal, and he was bitten by a dog. At 11 p.m. in the night in Himachal, and he didn't know what to do. So he went to some of the online platforms, and he found some doctor, and he had a consultation. So he said nothing to worry about. It's a very small wound, and he was prescribed things. I think that's really good, right? Like there may be places where immediately you can't go to a doctor. So that's where I think AI is having its edge. So it can really help patients and also doctors to make the right clinical decisions. Like our journey has been, as I mentioned, we started with an educational tool, but then we have pivoted to a patient facing solution. And some of the innovations that we have done is, during the time of COVID, we developed algorithms for COVID, wherein we used AIMS algorithms, and we actually got an award from George Institute of Public Health. It's a global organization working in. So we actually applied to it, and we were the finalists, and we got the fellowship also. So that's one. And then also we made the algorithms available in 6 Indian languages. So Hindi, Bangla, and 4 South Indian languages: Kannada, Telugu, Malayalam, and Tamil. So we believe that in India, English is definitely there, but that's for an urban kind of an audience. But I think more people are more comfortable speaking in their language. So that's a. And so like you're seeing the digital human just beside my face, Maya. So she can actually interact with you. We are also trying to incorporate Maya to a screen. So we are initially working with some of the interactive screens, wherein if you go to a hospital, you'll find the screen, and in fact you can actually interact with the screen even before you start interacting with it. So that ways the entire experience becomes seamless. Even before the doctor meets you, there's a clinical note which comes into there, and doctors don't like typing. So typically in an EMR, I'm talking to you, I'm typing. That conversation can become a bit difficult to do. So we can do the initial clinical note, and then he understands which doctor needs to be seen better. So that's where we are right now.
I think you have explained it in such an amazing way. Even when I was going through your website, so the one thing I really liked about you, like you have covered everything, like starting from the medical training to patient experience. I think you have bridged the gap between when we started healthcare, we have also thought of same way. We know future tech is everywhere, and in healthcare also tech will be making its space, not in India, like not in right now, but after 20 years definitely. So but medical students lack this kind of skills that are will be needing for the future. So we also started healthcare with the same vision. So let's build. First of all, let's do some awareness in the in this space. about how healthcare is integrating into technology and how things will become more seamless after this. So that's some amazing things you guys have been doing. Also, the one thing you have mentioned, in India, if we want to scale, it's very important to do stuff in regional languages, because that's the main problem. Yesterday we are having live with Siddharth sir. He has been working in sports and fitness tech. He has his own startup known as Tello. So he was also saying us the same thing, that in India, it's very important to create content, or to if you are building an application in different languages, because that's how you grow in India. Absolutely.
Right.
Makes sense.
Yeah, exactly.
Yeah.
Yeah.
So, yes, move on.
Yeah, so it's good that you're creating a series of all these educational awareness programs, so that more people are aware about the AI technologies. And I think being the youth, I think getting exposed to the latest technology, including AI, ML, and blockchain, which is coming up. So mostly these technologies are being used mostly in the engineering colleges, where I feel people are building products. But I really want doctors and other paramedical staff to come up with their own innovation. The reason is, mostly we are the people who are at the forefront, and we are actually seeing the patient, we are seeing the problems in real life, and we actually know that this is a problem, and in a lot of times we don't know how to solve it. And with the right team and with the right mentorship and support, I think a lot of people can come into building really good products for the global market.
Definitely. So moving on, like new technologies and treatments, like precision medicine, digital therapeutics, 3D printing, gene therapy, and whatnot, like they are arriving or have arrived in the markets. So what do you personally think that the future of healthcare will look like? And if you could explain it in a layman language.
Yes. So I think the future is going to be really exciting, not only for healthcare, but even doctors will have a lot of edge over the current the way medicine is being practiced. For example, surgeons, like there are 3D, the robotic surgery which is coming up. So training doctors will be at a very different realm. That's what I'm actually foreseeing. So there are augmented reality training centers coming up. Even in India, we have a lot of simulation training happening. So when I was doing my medicine, maybe there were very handful of centers in India, but I think a lot of good colleges in Bangalore, Delhi, they're coming with their own simulation centers, where actually you can get trained on a simulation device, so that the risk of an injury to a patient can be definitely not there. Because a lot of times we in medicine say, don't hurt anyone, right? So that's one thing which is coming up. And with robotic surgeries coming in, the precision is really better than the human hand. So anyway, the doctor is definitely there, but some of the very minute surgeries, it can really become better with the robotic surgeries. And I think 3D printing is coming up in a big manner. So like for example, in orthopedics, you may have to build a mold or something there. I think 3D printing can come in handy. And also there are a lot of forecasting happening which says that in going ahead by 2050 to 70, there can be a world wherein say if your heart is not working properly, you can take out the heart, you can 3D print a heart and keep it there. So you almost attain immortality. So these are currently looking like science fiction, but it may come true at some point in time. Technology is becoming better and better every day. What I really like currently is the drug development process. So previously, when we were working in pharma, the drug development process takes a long period of time. Now there's an AI-based drug development process. So they actually can make the entire drug development process more better, and it is solving a lot of problems for the pharma industry. Then for medicine, like we said, we are trying to reduce errors for doctors. So that's one part where doctors get saved. Also, the cognition, burnout, etc., can be solved. And for the patient, also, they are more aware about their own health. So, and I'm also foreseeing that home-based testing will also become a huge thing in the near future. There are also a lot of companies coming in this space. There's Neodocs from Bombay who's doing urine-based home testing kit, which can predict a lot of things about how things are in your body right now. So I think home testing will increase in a big manner. You can directly order a test, and also for cancer screening, because we see that the incidence of cancer is growing heavily in India and in developing countries and across the globe, and chronic diseases. Now you can use your Apple Watch and your smartphone to track your health. So those things will become more and more prominent. People will be using that to track healthcare. So I think that's going to be the future.
Absolutely. Maybe as you're talking about cancer screenings and chronic diseases, maybe 20 years from now, cancer and diabetes could join polio as a defeated diseases. We never know. We expect and also we expect prevention and early diagnosis maybe will be the central to the future of health. Also, not only will technology help cure illness, but the innovation will also boost the morale of people who are living with illness. Because with the technology, it's way more easier. We can treat some of the major diseases which right now it's not possible to treat with the help of AI or as we mentioned, like 3D printing and robotic surgeries. In India also there are some of the hospitals who are working on robotic knee replacement surgeries. In Bangalore only there's one hospital which are working. Also like radiologists are the ones who will be getting the more benefit of AI. Also, industry leaders across different verticals are setting examples of how cognitive technologies can be adopted digitally to transform healthcare. And many of these early adopters are betting on artificial intelligence to give a competitive edge. But deploying artificial intelligence models in clinical setting, however, it's way more challenging when we think. So what do you think? What are the biggest roadblocks in AI ML models for healthcare settings?
So good question, Deepika. So what has happened is the medical data interpretation industry, they have been doing really well with AI. So you can look into millions and millions of data relations and come to some analysis. But having said that, we also have seen patient registry. So maybe for cancer, rare diseases, we have registries in place. And previously, this entire registry was not handled. Now we have cloud-based systems where, for example, for a state, whatever happens, like you are every day you're seeing the COVID numbers. So it's being tracked very diligently. So everything is in the cloud. So the moment one lab diagnoses a COVID patient, it gets automatically uploaded to the cloud. So, the government or the people who are viewing it, they have an absolute view of what is happening. So you can predict. So for example, Kerala had a Nipah outbreak. There was some news about Nipah coming last couple of weeks back. So, so any epidemic diseases can be immediately notified. And in fact, some of my older systems that we have worked with, we have seen that in a hospital, if a doctor is, looking for a particular disease, they can predict there's a high incidence of, say, malaria or a dengue happening in the hospital because they want to learn more about that. So that's what Google is doing. Like they understand people searching for a particular thing from a particular location. There's something happening, and that's what they're searching. But having said that, in medical data, it's a lot of privacy issues which are coming up. So it's a very secure data. So there has been a lot of instances where the data is getting leaked or the people who are handling the data were not careful enough. So that's one reason medical data interpretation and this space is getting too much regulated at this point in time. So for example, as a company, if you are registered in the US, governments will say that, we need the cloud or server to be based in that country because they don't want the data going to a different country. So based on all this, a lot of companies have started setting up local data warehousing and other things. So we'll see more of a lot of privacy issues getting sorted in the near future, and also a lot of GDPR is also getting adopted across the globe for Europe, and then in the US there's HIPAA compliance. So these compliance, when they come into place, there is some kind of security which every company needs to. Otherwise it will become a problem. So patients also will become more and more aware that their data is secure. So they'll be more comfortable sharing, more details about their medical conditions. So that can be analyzed. Another thing where I'm seeing a huge drive will be, say, for example, you go to a hospital in Delhi and it's a network of large group. And now suppose you have to come to Bangalore and then you have to get admitted in a hospital. So now your lot of data is within that hospital system, but this current hospital may not be access this data, because they can't see what's your past medical history, whether you had a surgery before, you have some allergy to some medication. So these are important data which can add a lot of value. So this interoperability of data, medical data, has been an issue because no health system is confident that, okay, can I share that? So, but we have seen now the stock markets getting more regulated, and more the interoperability is getting more and more better. For example, insurance, you can port to a different provider. Say now you're with this company, tomorrow you want to go to a different insurance company, you can directly port to them because they have all your credentials. So similarly, I think if you're healthy, if you are doing a lot of exercise, your fitness data is also getting tracked. How much you're walking, how much you're running, what are the other activities that you do. So based on that, maybe your insurance premiums can come low, or someone can offer you a better package. There are a couple of good startups coming in this space. I recently found a company in Bangalore, so they are working on a lot of these parameters. And then I'm also seeing some startups which are going to help you in OP related things, because most of the insurance works in a way that if you get admitted, you get the payout. So now people are coming to that space. They're also getting insurance coming up in dentistry and cosmetology and other procedures. So I think a lot of innovation is happening. People are looking at innovative models. And again, yeah, so I think this will be really a hot space coming up where investors will be queuing to put in their money.
Absolutely. We had one of the interviews with the founder of Pedo.ai. They are also the Bangalore-based startup. They are working on insurtech only. So he was also telling us that we'll be, asking some of the questions to the patients, and based on that questions and based on our data, we'll analyze which is the best treatment plan or which is the best insurance plan we can provide them. Absolutely. Yeah. Also, maybe what I think is, like, in medical industry there is huge amount of data, but it's not structured data. It's very much fragmented and unstructured data. So it gets very difficult for the hospitals and all the clinical settings and AI ML researchers to build a model out of that unstructured data. That's something a difficult part, what I think is. Also, when moving on, talking about logistics services. So logistics services help the pharmaceutical and healthcare industry maintain a continual stock of drugs from suppliers and distributors across varied locations. But when we talk about the COVID situation, so it has impacted a lot. Supply chain has been impacted a lot. There was drug shortages, there was oxygen shortages. So what do you think, how artificial intelligence and machine learning could be proved beneficial in supply chain management? How to improve supply chain management fundamentals? How can company improve their supply chain management fundamentals, or how we can make it more agile so that we can face this kind of crisis if we come across in future?
Good question, Deepika. So I think that's a very nice field where I think not too much of people are working on this supply chain management in pharmaceutical industry. But I think there are a couple of companies coming up in this space too. So I think I initially heard that one of my friends were working for some of the, I think McD or some of the food companies. So they were already doing some work here wherein they look at data, so they understand. Say between 5 p.m. to 8 p.m. that's where maybe more burgers are being sold. So they make sure that they prepare everything in advance during that time. So maybe from 10 to 12, hardly any orders, but then at a particular time and a particular day. In fact, if you go to some of the data, you feel that in July or say in September is when actually more burgers are getting sold. So it's a very random analogy. But having said that, the same thing can be applied in pharma industry too, because now during second wave, we are maybe expecting a third wave too. So based on all this retrospective data, we can always analyze and say that, okay, maybe this state requires more medications in this particular space. Now, the usage of antibiotics, antivirals have gone up. Now, before there was a vaccine shortage, but I think those things are getting down right now. So I think some people can be almost working there. And second part is using drone delivery. So we are also saying that there's a big company in Africa, I'm just forgetting their name. So they have been doing vaccine delivery over drones, and India is also embracing drone technology for surveillance and also for managing the crowd in agri-tech, etc. So I've also been said that in the hilly regions of India, the northeast, they are also trying to look at how medication delivery using drone can be more beneficial, because there's no need. It will take a lot of time for someone to deliver in some of the more difficult regions. And then we have minorities who are staying in, say, very different terrain, difficult to meet them. So there also medication delivery can be done through drone. So I think that's going to impact supply chain in the coming months. And then we have a system wherein we have Anganwadi worker, Asha worker, etc. These staff is actually doing a very pivotal role in promoting healthcare in very, very rural areas, right? So the expecting mothers get a lot of advice and medication supplements from them. The children get a lot of supplements from them. So they are one of the pivotal people out there doing a very, very remarkable work. And maybe with some device, we can also collect data. I think there may be something already there. So this can also be incorporated. So locally, at a micro level, hyper local level, also we can analyze and predict, okay, this may be a place where things are not getting at the right time, or there may be a shortage coming up. So this can also be used.
Absolutely. Also, there is a lot of amount of data, which there are so many factors and maybe historical environments where we can analyze at what time we could need so much of medicines. For example, GSK is working on demand sensing tools, which are based on artificial intelligence and machine learning algorithms only. And the programs are AI/ML algorithms are being programmed in such a way that they can provide insights and trends, so that that could augment their planning capabilities for future. So there are companies that are working on supply chain management, but let's see what future holds for us. So coming to my very last question, that is, which is your favorite AI application, like in general and in healthcare space as well? Also, like, do you believe revolution is knocking at the door of the healthcare sector, which bears gift of all the sorts?
Okay, so I'll answer the second question first. So AI will not replace physicians or people working in healthcare for sure. But people who don't use AI will be replaced because there's a high chance of you're not getting updated or you're not using the right tools in place. Now, say for example, there has been a lot of revolts happening in the previous past where when computers started coming in for reservation, there was a lot of protests. People felt that people are going to lose jobs. But now imagine booking a ticket without a computer, or everything is getting very automated, right? So it actually
creates a lot of opportunities.
Exactly. So now that's what is going to happen with AI. I think a lot of jobs are getting lost for a lot of people, but then people who utilize that to create something new will be at a very better position for the future. So one of a very nice company I found out very recently is called Bina.ai, BINAH.ai. They're an Israeli startup. So what they do is they have a mobile application. It's a SDK, and you can use your selfie camera. Just open the selfie camera, click in like 2 minutes, 3 minutes. It will tell you your respiratory rate, your SpO2, just from the mobile camera. So I just blown away. Yeah, so you can check it out. So we were actually in talks with them for a collaboration. So they showed me the entire demo. I was really blown away by the technology. So they're using some signal processing and all that. And so the entire thing is now, if you're an insurance company, typically, if you want to take an insurance, what they'll do is they'll give you a list of tests to be done. So now you come there, they say you do this test and come back. Then I may decide whether to do it or not. And it's again reducing the customer experience get kind of there, you may not want to do that right now. So maybe the patient will take another couple of months to complete that, and by the time he does that, he may even forget for which company's insurance I was actually going. So with their technology, what they're saying is you just open your camera and open all this. They'll check all these things. So respiratory rate, SpO2, a lot of parameters in place, and then they decide at that point whether we'll give you insurance or not, and at what price. And yeah, and they can also find, I think, some blood pressure monitors or parameters also. So they immediately tell you what needs to be done. So it can be used for screening. It can be used for a lot of other industries also, and it's a marvelous technology. I think a lot of companies are coming up using mobile phone as a medical device. So again, it will take more time to understand how much technology will evolve and how much people are comfortable. And I think a lot of research also needs to be done with clinical trials, etc. Because if you want to be a med device, then there's a lot of regulations which needs to be done. So it's a long process, may take 3 to 5 years. But having said that, I think so. This is one of my favorite applications very recently, and yeah.
I swear, it's really so exciting. Only in couple of minutes you can get the whole amount of data. Abhi to we are going for test, we are doing respiratory test, itna sab kuch, and but with this technology, definitely the time will also once again. So I think yes, it's really amazing. So thank you so much for sparing your time and having this 30-minute short conversation with us. And in 30 minutes only, it was such an intriguing conversation. I really got a lot of insights from you. So thank you so much. Thank you so much, sir.